You are listening to Radio Ramadan 365 podcasts.
Welcome everybody to Radio Ramadan 87.7 FM, and I'm your host, Dr. Nadeem Bhatti, and I'm introducing a program that we like to call "What's Your Speciality?" and it's just something where I get to speak to people from doctors from other specialities and other fields, and it helps me get over my sense of inferiority complex being a GP. And I feel I'm enough. So I'd like to welcome here Dr. Phillipa Whitford, who I would probably describe as a bit of a polymath because she's a surgeon specialized in, I believe, breast surgery, set up healthcare centers in Palestine, the West Bank, the occupied territories, and then decided that she was going to become a member of the Houses of Parliament. So there's probably a lot of other things that I don't know about. So Phillipa, welcome to What's Your Speciality? And yeah, so if I could just maybe ask you the first question, because as we're talking to other doctors, why did you do medicine in the first place?
Well, my sister is 11 years younger than me, and her and my mum, they were struggling a bit when she was born, and she was born by a cesarean section. And I remember that it really struck me how amazing that was, that a doctor could kind of open somebody up and fix a problem that was really dangerous. So initially I was thinking gynecology, obstetrics, but then very quickly that evolved into surgery. So it was actually from a very young age that I wanted to be a surgeon, and obviously, being a doctor was central to that. Also, I'm quite arty. I went to the Charles Rennie Mackintosh at night for 4 years over during medical school, and then also when I was a cancer researcher. So I'm quite good with my hands, and I thought that was the obvious specialty to me for me. So it was always surgery. And then I was halfway through medical school, had done very well in the surgical block, and had just finished an elective at the Western when a consultant broke it to me that women couldn't do surgery. And
Oh,
for a while, I thought they were just winding me up because it was an evening out. We were all in the pub, and I literally thought he was joking, and then realized he didn't mean it like it was his opinion. He meant it like, aren't you aware of this fact of life? And I discovered that there were no women surgeons in Scotland and very few in the whole UK. And that just, I mean, to me, that was just kind of cataclysmic. This
can
is
I ask
why I'm
what year
doing
that
medicine.
was? What year was that?
That would have been about 1980, something like that. Yeah, about 1980, in 79, 80, somewhere around there. So I mean, I had to go back and think, but that's why I'm doing medicine. Kind of what do I do if I can't do surgery? And I did love already, even as a student, being involved with cancer patients. I did my dissertation on death and dying, home hospice hospital. And so that was when palliative care was beginning to develop, hospices were beginning to develop. So that became my kind of backstop. If it's really not possible, I will go into cancer care and palliative care. But I'm jolly well going to give it a run for my money. So kind of putting my head down, sticking my elbows out and my horns forward, and I went for it basically.
Wow. So, where did you go to medical school?
Glasgow. I mean, I'm not sure if you're aware, but I'm from Belfast. I came to Scotland when I was about 10, lived in Dumfries, then lived down in Hertfordshire and went to school in London, and then Glasgow. So it was Glasgow medical school that I went to, but I went back to Belfast to start my surgical career. So after my house jobs, I applied for a trainee job in Belfast because I was keen to go back and explore living back at home, and that was at the height of the Troubles at that time.
I mean, you know, going from medical school, I'm assuming that you had a great time there, enjoyed it, did well to get into surgery, and being a woman, I'm sure you'd have had to do very well to even be allowed a foot in the door.
Yeah, I mean, there was no question. I remember Avril Valentine, who was a vascular surgeon in England, kind of quite elderly. I remember her saying, "We will only have equality when we have mediocre women surgeons," because at that stage, you were constantly having to prove yourself. So I did my primary fellowship the October after being a houseman. I was only the third person to ever do that, to do it so early. Normally, you did it a year after being a houseman. I did research early. I had to look at trying to publish early to get considered for anything. And I mean, I'd written to the team at the Royal Victoria in Belfast just a sort of Giza job letter. I mean, I'm
Yeah.
from Belfast. I want to do surgery. I'd quite like to come. And when I went for the interview, I was directed go down there. Everyone's sitting in that corridor, and it was all kind of men in their 30s. Some of them
Yeah.
with grey sideburns. And I went back
Yeah.
up and said, "I think I'm in the wrong place." And she said, "No, no, no. This is the registrar interview. Go down and join." And I think in the end of the day, it was a sort of, "What do you think about this weird woman from Scotland? Shall we give her a go?" kind of thing. And I got the job as a senior house officer. And in Belfast, they had relatively few juniors. So for four consultants, there was myself and a senior registrar. So it was in his interest to teach me as much as possible,
Yeah.
as quickly as possible. Right,
Yes.
this week you're learning appendixes, now you're learning gallbladders. So, it was great. I got both in general surgery and then in trauma and orthopedics. I got really great experience, and a lot of it was kind of, what, a woman, let's see what she can do. I mean, I had one orthopedic consultant who the secretary warned me he's not very happy, and he slammed into the anesthetic room, marched up to me, squeezed my biceps, and looked me up and down and said, "Well, maybe you'll do." And never allowed me to use power tools. He used power tools all the time. I always
Mm.
had to do everything by hand, but he did let me do an awful lot of orthopedic surgery that my peer group in Belfast of the same kind of age were not getting to do. So there was that sort of misogyny, but equally there was a putting you through your paces that I benefited from, that I actually got to do an awful lot of surgery for it being my first year when I was in Belfast.
I mean, that is in, I mean, when I think about it, I started medical school in 1985, and I'm thinking that was only 5 years before that you know, is that when you started medical school, did you
No,
say?
I started in 77. So I was in
Okay.
third year. So it was I had done a surgical block and then done an elective at the Western at the end of third year. And that was then, we were all going out for a night out, and it was kind of, "Well, what is it you want to do?" And I said, "Well, obviously I want to do surgery." And it was, you know, "Don't you know that you can't?"
Okay. Okay.
And,
Okay.
and, uh,
Yeah.
and I mean, it went on like that. I mean, most of the jobs I ever did before I became a consultant, I was always the only woman, and often referred to that woman and so on. And when I came back from Belfast to Glasgow, I'd applied for the West of Scotland training rotation to come back to. So this is like 80. This would have been 84. So just before you started, and 16 grey-haired men round a table asking me questions and talking absolute rubbish. Women don't have the mental capacity, women don't have the physical capacity. And I decided to go for it. I thought, I've nothing to lose. I'm kind of going, well, I can't believe anyone here would be that stupid to believe something so ridiculous. And then one of them kind of piped up with, yes, but what about monthly mood swings? That would be a real problem. And I said, well, I've worked for consultants with daily mood swings, so surely monthly would be an improvement.
Did you actually say that?
Oh, I absolutely did. And the last question was, because they were interested in my logbook from Belfast. They could see I had the opportunity to do a lot and had dealt with, gunshot wounds and kneecappings and significant trauma and all the rest of it. So they were a bit interested in that. And they said, well, actually, we think you're quite talented and you've already got your primary and we would back you in a career in surgery, but you'd need to agree never to have children. And I kind of said, I'm sorry, I'm not willing to give up my right to motherhood for a job. And then it was kind of, well, thank you very much, Dr. Whitford, we'll let you know. And I came out of the room thinking, I'm unemployed in about 3 weeks' time. I mean, this is how ridiculous it was. And this is long after, equality legislation, the first kind of stuff in the 70s. I mean, that's exactly what it was like in the 80s for women trying to push through in surgery. You just had one barrier, one hurdle after another.
I'm kind of speechless hearing this. And, as you can see, I come from an ethnic minority. My family came from Pakistan. So there were sort of similar challenges, but, I've never really heard it quite as stark as the way you're saying. And I mean, at the time when somebody's saying this to you, what was going through your head? Did you just challenge them straight off, or did you just swallow it and take it in one ear and out the other? Or did you actually think, I can't believe what I'm hearing?
Well, obviously, when it was said to me that first time, I couldn't believe. I mean, we went on discussing it for ages before I realized it wasn't a joke. But later on, I got that I was often quite cheeky and robust, as as I was in that interview, because people had said, just tell them what they want to hear, tell them you'll never get married, tell them you won't have kids, maybe you'll get through. And I thought, I will never have these 16 leaders of the profession listening to me like this ever again. So even if I don't get through, I need to just go for it. I need to say what makes sense. And I'm a pretty rubbish liar anyway. So I wouldn't have managed to finagle some simpering little, obedient lassie. I mean, that isn't me. And whenever I kind of met sort of misogyny or cheek, I kind of tended to be reasonably robust or cheeky in response, in a way of making humor of it, making light of things, making people realize how ridiculous what they were saying was.
Oh.
And I would always prefer, I mean, in my experience, and I did work for, like, the orthopedic surgeon, some old misogynist, at least with them, you knew where you were. What was worse was surgeons who pretended to be all sympathetic and working with you, but were actually, sowing poison behind your back. So at least with those ones, the harder you worked, the more you showed what you can do, the more you showed that you were reliable, that you were a good surgeon, you could actually gradually win them over. Whereas someone who was out to kind of poison things behind your back, you couldn't deal with that in the same way.
I mean, Philippa, I think we could probably have the whole program just about your challenges as a woman going through surgery. But I know there's so much more to talk about. But maybe one question just to touch on that is, at what point did you think, oh, something's changed? We've turned a corner. Was there a point where you suddenly went, oh, that's different?
It was already when I was a consultant, and there was one point at which I had an all-female team. So my registrar and my senior house officer, as well as my houseman, were all women. And I said, right, we're going out to tea. to celebrate this, because this is just fantastic. And when I started out, as I say, there were no women surgeons in Scotland. I think in the UK it was like less than 1% of consultant surgeons were women. I mean, there were very few and far between. The last time I saw figures, which is maybe a year and a half ago, 41% of surgeons are women, but only 14% of consultant surgeons are women. So it's enormous progress, but it's still an awful long way to go. So the 40% shows that we have women who want to do surgery, who are willing to put up with the challenges, but the 14% shows that actually there are still probably far too many ridiculous hurdles. What helped me in the end to become a consultant is I was actually the first part-time flexible trainee in Scotland. This was after I came back from Gaza. So my senior registrar job in Aberdeen was technically part-time. I worked about 50 hours a week. I got paid for 21 of them. My nanny earned more than I did, but at least I was a senior registrar. And in those days, that was the kind of gate that you had to get through to have any chance to become a consultant. And so I did have that opportunity. And obviously we have a few more flexible trainees now, thankfully.
Okay. So you became a consultant. Now, you were a consultant. At what time did you have to do your specialty training, or were you just a general surgeon, or was it more of a, by that time, were you specializing in breast cancer or breast tumors?
There was, the system was very different then. I mean, you had SHO registrar, senior registrar was you being kind of groomed for the final approach to being a consultant. At that time, there was no such thing as the specialty of breast cancer. I used to go for my registrar assessment every year, saying I wanted to be a surgical oncologist specializing in breast cancer, and they would laugh at me and say no such thing. I then went to Gaza after I'd been sort of 9 years qualified. So in the early 90s, 91, 92. So as a registrar, and at that time I was still doing general surgery. I had done vascular, urology, plastics, pediatrics, all these kind of things. But my special interest was breast cancer. My MD thesis was breast cancer immunology, the papers I'd published. So I had already made that decision, and it came, some of it was fluke or fate, depending on what you believe. My first house job was with Professor George's unit in the Western, which was a breast cancer unit. And I learned a lot, because in those days your bedroom was on the ward. I mean, you were on a 1 and 2, so you lived in the ward for 6 months. And so I got to know a lot of the patients, and I heard a lot of their experiences and what frightened them. I saw that, because this is back in the days when women went to sleep with a breast lump, it was examined in the lab while they were asleep, and then proceeding to mastectomy. And you watch these women coming back in the trolley, groping themselves, because they knew if they had a lot of bandages and a drip, that it had been cancer. So literally that's how they would learn they had cancer. And, I would have to say, breaking bad news and communication was pretty poor in the early 80s. So I learned an awful lot from them. The unit I worked in the Royal Victoria, Professor Roy's unit, happened to be a breast unit. And when I came back and finally got on the rotation in the west of Scotland, I worked with Professor Colin McArdle, which was also a breast team. I mean, I did other stuff as well, but so it kept being there, and he was saying, I think you should specialize in this. It is it's going to evolve into a specialty, and we need breast cancer surgeons. And I kind of said, well, it's a bit cliched. One of the earliest women surgeons in Scotland does breast cancer. And he said, what are you waiting for? The Monty Python hand of God to come down and point at you? He said, I'm the professor, and the follow-up patients are starting to ask to see you. He said, you really need to think about this. And I thought, it's such an abysmal service to women in those days. All I could do would be make it better. I couldn't make it worse. And that's
So
when I made the decision, although it would still be general surgery with a special interest in breast cancer, that would be the target of my research and my specialty. And I did plastics as well with Martin Webster to learn principles of breast cancer reconstruction, things like that.
So let me just ask you, you mentioned there just briefly about going to Gaza. So obviously this is Radio Ramadan. A lot of people from, basically a lot of Muslims are going to be listening to this. And obviously with what's been going on in the news, we just can't get it out of our head. How did you first get involved with it? And why did you even think of going to Gaza?
Well, the other thing that I used to get laughed at my registrar interview is that I said I wanted to work overseas and do some developmental work at some point, not as a permanent thing, but for a couple of years. And they would say, no, you can't do that. If you leave, you can't come back. So that would come up every year. And then when I turned 30, I kind of thought, I need to get on with this or I'm not going to get to do it at all. So my husband, who's German, who used to keep saying, I've already gone to a developing country. I've moved from Germany to Scotland. So we started looking for overseas posting. I have to say, him with lead boots on. I mean, I was dragging him. But we registered with a thing called British Overseas Medical Service, and you would get a magazine every other month with literally adverts for everything, vaccinating in Nepal or whatever. And there was this somewhat ridiculous advert from Medical Aid for Palestinians, and it just said wanted war surgeon. And I would just turn the page. I mean, I thought that was so naff, I didn't even pay any attention to it. And we explored with different charities, British charities, German charities, but we were struggling to find something where it would use our skills. There's no point in putting a surgeon in a tent with sticking plasters. We need a hospital. And so eventually I kind of said, I really must actually read this stupid advert properly. And it turned out that they were looking for a surgeon with kind of skills in urology to set up a urology service while a Palestinian surgeon was in London training. And I had done a year of urology. And they were looking for an anaesthetist to run the intensive care unit that MAP had built in Al Ahli Hospital. And I thought, that's us, because that's what my husband was doing. He was doing anesthetics and ICU at the time. And I thought it might be rather badly worded, but this advert is us. And as soon as we got the letter back describing Al Ahli, which obviously everyone knows well in Gaza City, the first hospital to get hit in the, the current Gaza conflict, it was clear that this is somewhere we could work, and importantly for me, where we could be teaching and training. And we went out. We were there about 16 months in Gaza City. So I was doing general surgery and particularly setting up the urology services, but also dealing with a lot of trauma. I mean, this was just after the first Gulf War, during the first Intifada. A lot of gunshot wounds, both simple and complex. What we didn't have to face is what our colleagues have had to face in the last 2.5 years. We weren't being bombed. So we didn't have the blast and crush injuries, the traumatic amputations, these kind of things. But it was neglected disease. Everyone would present late. Every appendix was burst. Every ulcer had a hemoglobin of 4. Diabetic feet that you ended up with amputations and so on. So that was really the challenge. But interestingly, the young doctor said to me when I kind of said, well, what about breast cancer? Oh, we don't see breast cancer. Our women marry young. They have lots of children. So we don't see breast cancer. But as soon as word got out that the Ajnabi doctor was a woman, they just came out of the woodwork. So actually, I ended up treating a lot of breast cancer patients back in 91, 92.
Okay. And at that time, were you aware of the political situation? I mean, back in 1992, I'm assuming that, or even before that, Palestine probably, and the idea of Israel, I mean, the narrative was very different. The narrative was very much that, poor Israel is being attacked by everybody all around, and the Palestinians are creating all this trouble. I mean, what did you think, or did you just go there thinking I'm just going there to abroad to help?
I mean, our primary motivation was looking for a post to go abroad to help, and particularly to be able to leave our skills behind. I didn't want to go somewhere and then when we come home, it all falls apart. But what had been happening, obviously, this was during the first Intifada, which was the stone against the gun. There had been the Al Aqsa massacre on Temple Mount. So what you were seeing was obviously the young Shabab throwing stones and then being shot in response. So although there wouldn't have been the same global awareness like we have now, there was beginning to be a consciousness of the power imbalance and the kind of trapped nature of the Palestinians in the occupied territories. So while in the 70s it would have been the PLO, they're terrorists, they hijack stuff, there was beginning to be this recognition in the kind of late 80s and early 90s that actually these people do not have access to human rights. They are under occupation. So that was beginning to grow there. But I wouldn't have said it was, that's what we started out looking for. We considered all sorts of parts of the world, but you couldn't be there longer than a couple of weeks without seeing the injustice. I mean, Gaza was still under direct military control by the IDF. So you had these clashes, you would get gunshot wounds in, all the time. They would then come and raid the hospital and arrest anybody who had a gunshot wound. So we either had to get them back out and home very quickly, if that was possible, or hide them. So we were literally stashing people in hidden corners of the hospital to try and avoid them being arrested. And, there would be shootings and clashes happening all the time. I mean, so there was a lot of violence. I mean, Hamas then were tiny. They didn't have a lot of influence, although they were very anti-Westerners being there, even if you were there as a medic. So they would attack your car or things like that. But they were very small scale back in the early 90s. And the majority of people who were there, once they recognized who you were actually really helpful and supportive and immensely kind. I mean, I for all the stress, I loved living in Gaza. I mean, I was actually very happy living in Gaza for the time that we were there. I didn't particularly want to come back. I would have been open to staying longer.
And how long did you stay there altogether then?
16 months on that occasion. But my husband, whose long-term aim was general practice, like yourself, he had arranged a trainee job to come back to on the Isle of Mull. And so the plan was we'll come back, he'll get his exam, he'll finish all his training, and then we'll make a decision. Do we stay back here or go back overseas? I was approached about maybe working in the European Gaza hospital, which was just being built at that time, which I would have been interested in. And I then went to Lebanon for a couple of months on behalf of Medical Aid for Palestinians during that time when we were living in Mull, kind of looking at the state of hospital services in Tyre and Sidon after the war. I mean, the hospitals had deteriorated down into just big casualty departments, and it was, to come up with a plan for redeveloping the surgical departments. But I very quickly realized you can't do that in isolation. You actually have to look at all the departments.
Okay, so obviously you did that. Did you come back? Did you keep going back, or what was your relationship with the people there after that?
No, when I came back, I finally got pregnant with my son just before we went to Mull. So I was doing locums in Oban, obviously went out to Lebanon while I was pregnant with my son, and wrote these projects for MAP. And they kind of said, would you come to Lebanon and, deliver this? But they were still talking about something short term, maybe a couple of years. And I kind of said, you know, you can't schlep a child from place to place. I said, if you were willing to say, right, would you be willing to live here in Lebanon and help build this up as your main career? I'd have been open to consider that. But not that you're moving a child from pillar to post every couple of years. And then it was kind of working out where were we going to settle, and trying to get through, as I say, trying to get through that barrier, having been told that if I went overseas, I couldn't come back. I now had another barrier to get through to actually be on any kind of career path. But luckily, the dean in Aberdeen, somebody told me, had been part of this developing the flexible trainee position. And so again, I just wrote a Giza job letter, and he was open to that. So we went from Mull to Aberdeen. And then after a couple of years, I was headhunted to Crosshouse Hospital down here in Ayrshire and became the lead clinician for breast cancer services in Ayrshire and screening services for lead surgeon for Southwest Scotland. I kept in touch with friends. We had friends. One of my registrars became a consultant in Augusta Victoria Hospital. I went out and visited him in 2010. Well, with my husband and son, we went there for a holiday and spent a couple of days with him. And so, and he said, by then I was only doing breast surgery and reconstructive surgery. And I said, you know, I'm not much used to you. I don't do trauma anymore. And he said, well, actually, we have finally realized that you were right. We have a serious problem with breast cancer, and we don't have the training in it, and we don't have the systems and structure. So I kind of got involved a bit with them, helping to introduce things like sentinel node biopsy and so on into Augusta Victoria Hospital. And then in return, when I did return to Gaza in 2016, he then helped support the introduction of modern surgical techniques into Gaza as part of the breast cancer partnership I set up.
Fantastic. I mean, that's just unbelievable. I mean, I realize we don't have a huge amount of time, but I'm thinking, at what point did you, because you've been a member of parliament, at what point did you think my career is changing now, and why?
Well, I was very active as a consultant. I'd led a lot of national quality improvement within breast cancer for about 11 years, from 2000 to 2011. And I found that immensely rewarding, because you were doing the hands-on service and service development in Ayrshire for your own patients, but by being part of quality improvement and audit, you were actually driving up the quality of care for women you would never meet. So that was very satisfying. But I'm very pro Scottish independence, and always have been. And so when the potential for the independence referendum came up, I got involved, got very active. My husband and I did 5,500 miles in 2014, speaking all over Scotland, public meetings and so on. I was utterly heartbroken that people of Scotland didn't choose to run their own affairs. Now, in Ireland, we don't suffer from any lack of confidence, so I struggled to understand it. Why would you want someone else to manage your business? So I found that difficult after the referendum. And then I started having people going, oh, you need stands, you need to go to Westminster. And I'm going, you must be off your head. Why would I think of doing that? But I had been part of a group called Women for Independence. One of the founders was Jean Freeman, obviously our former cabinet secretary, who died recently. But the strap line was also independence for women. So it was about getting more women into politics. And her and I did a conference here in Troon, where I live, and we had over 200 women discussing, you know, the need for women to step up and get involved. And I'm kind of going to her, are you going to stand? No, you know. You know, but yet I'm up on the stage going, women need to pick up the baton and speak out. And it obviously worked on me. So despite turning down Alex Salmond and everybody else who'd asked me to stand, I kind of woke up the next day and thought, if not me, who? You know, I'm towards the end of my career. My son is grown up and at university. I could go to Westminster. And then I realized I should go to Westminster. And my husband, who'd started out with, don't you come home here and tell me you're standing for politics, he had already changed his mind and was kind of, I think you'd be good at it. I think you would enjoy it. And I think you just need to grab fate by both hands. And that's what I did. And at first, you're so busy fighting the election, you're not reevaluating it. And then, you know, I wake up on the state opening of Parliament in the House of Commons, and my husband sent me a wee text. He was watching the ceremony. He said, "Are you okay? You're really pale." And I just went, OMG, what have I done? But I was the longest serving medic in the House of Commons. So because I'd been a doctor for 33 years when I was elected. So I had the opportunity to bring the reality and the challenges of the national health to the floor of the House, including what was happening to the NHS in England. I mean, that's what I was speaking about during independence, the Lansley reforms, the outsourcing, the privatisation, and the fact that we were going in a different direction in Scotland. So you had the opportunity to share some of the innovation that was happening in Scotland, but also to highlight the challenges in the NHS in England, but also in care services, and to contrast that. So, and then of course that was particularly important during COVID, actually having the opportunity and the platform to explain what is this, why do we need to do this, what is important. Although I have to say that was probably the most frustrating period, being head to head with the likes of Matt Hancock. But it was going to Parliament that got me the opportunity to return to Gaza. So in 2015, I spoke in a debate marking the anniversary of the 2014 invasion of Gaza. And members of MAP were in the gallery and came to speak to me afterwards. And then they realized that I had been a previous volunteer. And, I kind of said, well, I don't do trauma. I purely do breast cancer and reconstruction. But they agreed to support me going out on a fact-finding mission to Gaza, because I pointed out, certainly when I lived there, the services for women were pretty grim. So in
This is about 2014, is it, roughly?
This is 2016 when I actually got to go out. So made contact in 2015 with MAP, and then we came up with a plan, and myself and one of their staff went out and we visited clinics and patient groups and realized that all the women I met had a mastectomy and an axillary clearance. They had, half of them had severe lymphedema. They didn't have any support services. I mean, it was like going back to the early 80s in Scotland. And so then this member of staff and I wrote a business case for MAP to set up a Scotland-Gaza partnership, which we did. And MAP would help fund. We would run 2 training visits a year, taking a whole team to work with their peers. And a colleague who'd been my senior house officer when I was a consultant in Gaza was now the director of hospitals. So he forced the creation of a Gaza specialist team, not just surgeons, radiologists within the public health system. And that was based in Al-Shifa and Nasser. We rolled it out to the West Bank the following year, but what was particularly successful with Gaza is we used to run an MDT meeting, a multidisciplinary team meeting, 7:00 every Tuesday morning, where we would discuss all the patients exactly as we would do here. And I had recruited specialist colleagues from all around Scotland who were really keen to be involved, who went on the training visits, but also are willing to get up at the crack of dawn on a Tuesday to join this meeting at 7:00, and then rush off to their day jobs. And that weekly contact and support and getting to know each other developed such a level of trust. Our colleagues in Gaza literally transformed their service. And because I had developed the kind of audit standards for Scotland, I introduced a kind of more clinically based, simplified version in 2019 into Gaza. And so when they were able to produce their first run of audit data, we saw that instead of 100% mastectomy rate, just over half the women were managing to keep their breast. And we were able to introduce sentinel node biopsy, reduce the rate of lymphedema, all of these things. I mean, it was they literally took the opportunity with both hands and transformed the care that they were delivering to women in Gaza. I mean, I was immensely proud of what they achieved in just a matter of a few years. Of course, sadly, all of that progress has been destroyed in the last 2.5 years.
Are you in touch with any of those that were involved at the time still? And where are they now? What are they doing? Are they even
Yeah,
there?
no, I'm in touch through WhatsApp with colleagues and friends. I mean, the doctor who set up the Gaza end of it tragically lost 48 members of his family in one night in November the 21st, 2023, including 3 children, 3 grandchildren, the youngest just a 5-month-old baby. He managed to get out of Gaza with his remaining 2 grandchildren and remaining child. And then in March last year, when Israel broke the ceasefire or smashed the ceasefire on the 18th of March, my best friend, I would say, from Gaza, Nadia, who I'd been in touch with through WhatsApp, her and her eldest daughter were killed. And I'm in touch with the kind of breast cancer team. And when I managed to meet up with them kind of online through Zoom because they were starting to try and reestablish some minimal breast cancer services, there was only one doctor still from the original team we'd been working with. We knew both of our pathologists were killed. Others we just don't know. Some may have got out with their families. Others will have been killed. Others may still be in prison in Israel. As we know, they seized a lot of doctors. So I have found it very hard this last 2.5 years with that personal connection. I mean, particularly with Nadia, we had been WhatsApping just a few days before about all the delicious food she would cook for me when I would get back to Gaza, and that we would be able to have real hugs instead of emojis. And then, suddenly her and her eldest daughter are killed by Israel when they smash the ceasefire. To survive 15 months of war and then be murdered in a breach of a ceasefire is very bitter.
It's really difficult to know what to even say to that. At what point were you still an MP at this point, or had you then sort of gone back to clinical?
No, I mean, I
support?
was an MP up until the election in July 24. So when at the start of the conflict in Gaza, I was still an MP, but then stood down. I mean, I retired. I didn't stand in the election. So when Nadia was killed, I was no longer an MP, but and had a pretty difficult year last year with my own. I had quite a few health issues and also nursing my mum, who was diagnosed suddenly with advanced cancer. But then from last summer onwards, had been touring around Scotland again, giving talks about my experiences in Gaza, and the other topic I talk on quite a lot is the well-being economy and the need to actually change the way we run our economy and society if we want people to have a chance at health rather than illness, which is, people would ask me to give a talk on health and they would mean the NHS, like I was doing in 2014. But as you know, the NHS is really about illness and managing illness and patching people up. And occasionally we're lucky enough and cure somebody. But actual good health comes from the first few years of life. And, it's important. The Scottish Government already have a lot of policies investing in children, but we need to change the underlying exploitation of people, which is what our economy does. We consider humans as just discardable resources for profit, and we treat the planet the same way. So I'm often out on the road kind of doing these kind of talks.
I've got to ask, what's your opinion of the way that the current ruling government, the Labour Party, has been dealing with Gaza and the whole issue? I mean, what do you think about that?
I mean, you can't really say anything other than disgraceful. When, I mean, obviously, we're not wanting to particularly be in party politics, but obviously, when I was still there, it was the SNP were the only ones speaking up for a ceasefire, pushing for a ceasefire, pushing for the UK not to sell arms to Israel in the early kind of months of the war. And you'll remember probably in February 24, that whole scandal where Labour got the Speaker to block our ceasefire
Yes.
vote on our
Yes, I remember.
opposition,
Yeah.
and that had never happened before. So we had all of this kind of stuff, and then I was absent for some months because of a health issue myself. And then when I got back, I remember in being in foreign affairs questions and in 24, and it was the usual kind of word salad from the minister, and I kind of said, do you not recognize that actually one of the biggest casualties of this is international law itself? You are
Absolutely.
defending the indefensible. You are destroying international law. And of course, they didn't accept that. They didn't recognize that. But we see that how that has permitted, Trump's attacks on Venezuela, his threats to Greenland and other places, where we are now with the Israel-US bombing of Iran, that all the gains that were made, and they were pretty shaky, there's no question. The invasion of Iraq was illegal as well. Mm-hmm. But what we now have is just purely might is right. That yes. There is, no holds barred. If you're powerful enough, you can do what you like. And here we are with this unraveling disaster in the whole Middle East, because nobody is willing to hold Israel to account. Nobody is willing to limit the power of the US to just inflict death left, right, and center. And we will all pay for that. We will all pay for that.
Well, I was shocked this morning to find out that, and I don't know if this is completely true, but apparently the right to trial by jury has been repealed by Labour. I don't know if it's for specific situations, but I mean, this is something we've had for 800 years in the UK or in Britain.
Well, obviously, there isn't Britain in law. Scots law is completely separate from English law and has been since the 18th century in the unification. So we have a totally different system. It is, for my understanding, is where it's an offence with a sentence below 3 years. So it's not going to be, murder and so on. And a lot of it is being done because of the backlog in the courts ever since the pandemic. But this kind of thing of using convenience to get rid of certain rights that people have. I mean, as I said, I'm from Belfast. We lost jury trials during the Troubles, and they had what were called diplock courts. So you had, if you go back to the political prisoners of the IRA, and I'm no friend of the IRA, I just feel it's important people understand some of these things. So they were tried in what was a political trial with no jury. They were then sent to the Maze prison. And then it was, no, you're not a political prisoner, you're a criminal prisoner. And therefore you don't have the rights of a political prisoner. And the whole internment, all of the things that happened in Belfast and Northern Ireland in the 70s and 80s, where, if you like, the rules were thrown out to get the result that was wanted, that ingrained a real hatred and suspicion. So even if it is, we don't have the time, we need to catch up, it should always be, think about it 3 times before you make a change like that. Because once you make a change like that, you're not going to go back. And the danger is that you have more miscarriages of justice.
We really don't have that much time left, which is such a shame, because there's so much we could talk about. I mean, this is Radio Ramadan, 87.7 FM. It is a time, it comes on during Ramadan, so people's faith is very important. Did you see anything in your travels there where people's faith, how it impacted how they lived? And did that have any kind of impression, leave any impression with you I just wondered.
Well, my faith is quite important to me. I'm a Christian. I happen to be a Catholic. For good or ill, I don't see any point in changing that. That's how I was brought up, and in a way, that would have been part of me wanting to go overseas. I don't get terribly caught into the details of dogma, but the basis of caring for your fellow man, I think, is quite important. It happened, as it is the same this year, when we lived there, Ramadan and Lent happened to overlap at the same time. So we had great discussions about what was harder, fasting all day, but having a feast every evening, or spending 6 weeks with no cake, no biscuits, no sweeties. So we used to have actually really, really good discussions, and we never had, other than, as I say, Hamas didn't want white people or Christians or, internationals there. We never felt unwelcome. I mean, I found, and particularly being Irish, I found the Palestinian culture very similar. It's about family. It's about hospitality. They're very lively. They're very much a Mediterranean people. And, as I say, I felt very at home there, and I loved living there.
Fantastic. I'm just going to leave you with one last question. Is there one bit of advice? I've asked this to everybody that's come on. Is there one bit of advice that you remember above everything else throughout your career or careers? And could you share that with us?
Advice that was given
that made
to
an
me.
impression on you, yeah. Or the most useful bit of advice.
I think the most useful bit of advice is, and it's through all the things that I've done, is to be true to yourself. So speak up for yourself, speak up for your patients. But regardless of which profession you're in, is have your own internal integrity and to stick to that. And so no matter what you do, I think that is something that's important to all of us.
Dr. Whitford, Philippa, thank you so much. Honestly, I could have been talking to you for another couple of hours, and maybe we will at some point in the future. Thank you again, and thank you again on behalf of Radio Ramadan 87.7 FM and myself. And really, I'm honored to talk to you, and just so great what you've done in your life. And
thank you very much, Nadeem. And when Eid al-Fitr comes, I wish you, your family, and all your listeners to have a wonderful time.
Inshallah. Thank you so much. Take care.
Take care. God bless. Bye-bye.